I actually got into psych by accident. I worked night shift and my husband worked evenings, and I desperately wanted to get on evening shift, and the only opening in the whole hospital was on a brand new adolescent psych unit. So I didn't think I wanted to do psych at all, but I went and met with the nurse manager and the psychologist that worked there and really liked them, and went there mostly to get evening shift and fell in love and have done it for the last 30 years. So most of my career has been child and adolescent psych. I actually went into leadership and I was a nurse manager for most of those years. And then 3 years ago, I had the opportunity to become the director of psych services there at my hospital. So now I work with all the ages, and I always interacted with all the ages. I covered floors, and I mean, we're a tight-knit community. We work together. Psychiatric and mental health nurses are one of your basic things that you do is you really spend a lot of time assessing and observing the patient, and you have to be a really strong communicator, and that means not just talking but a really good listener. So psychiatric nurses spend most of their day out talking with their patients. It's one of the parts of nursing where you still do that, and it's less of the equipment. You have to have very strong critical thinking skills. One of the other things that's really different for psychiatric nurses is our patients typically aren't separated out in bedrooms and just waiting for the care to come to them. You're out with a group and you go to therapies and activities as a group. So I manage not just each individual patient, I also have to oversee that group, we call it therapeutic milieu, and make sure that everything's staying positive and healthy, and that patients can learn a lot from each other by sharing their stories. Other healthcare providers trust me, they talk to me, they don't just look at the x-rays in the lab. They make me very much a part of that plan of care and trust my observations and, like I said, that relationship, because the physicians try very hard, but in a 15-minute interview is not the same as me who sat there and held your hand for 8 hours while you experienced the psychosis or discussed your severe depression or the traumatic events you've had in your life. So you and I have a bond beyond what any of those other healthcare professionals have, and they know that, and they trust my opinion, and they listen to me about what you need and if what we're doing is helping, because then I go back and say, this is better or this isn't. We need to do something else. I just feel like my opinion is so valued in mental health nursing. You get to go home every night knowing you touched a life and you made a difference.